Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us live once again here on LCTV for our Niagara County COVID-19 weekly update. I'm joined again today by our Public Health Director for Niagara County, Dan Stapleton. Dan, welcome.
Thanks, Becky.
Thank you for being back with us. We are currently streaming live on lctv.net, and we're also on 90.9 FM on your radio. Now, Dan, why don't you go ahead and just start us right off with our COVID-19 statistics for today?
Absolutely. We have 11 new positive cases as of Friday morning. That's a really great number. We haven't had numbers like that for quite a while. I harken back to the days when we had 54 cases over a weekend or more. So right now we have a total of 1,384 positive tests since we started. We have 38 active cases. One of those cases is in the a local hospital, but most of those are at home. And 1,250 people have recovered since the crisis began. So these are numbers that we're really feel good about. Thankfully, we don't have any more deaths to report. That's always difficult to report. 96 of our fellow residents we've lost them since the crisis began. So we're very thankful that the number has not continued to rise, but it's something that we continue to make sure we're vigilant about.
Thank you, Dan. Those numbers continuing to remain steady in Niagara County, which is what we like to hear, of course, with all of the news coming in from around the country with other states that are seeing huge upswings again. Of course, our Niagara County heat map has been updated again for you with our current numbers. This will show you again the breakdown by municipality, the towns and cities in the county, and where those positive cases have occurred over the length of the pandemic. So continue to check that out. We know that's important to you. We know that people are looking at those numbers. We've now had over 381,000 views of that heat map. Again, you can find that on niagaracounty.com at the top of the page and the COVID-19 banner. Also, when I switch to testing, I can let you know at this point we've now had 45,059 Niagara County residents who have been tested for COVID-19 in Niagara County, and that's according to the state's COVID-19 tracker. Again, you can find that information in our COVID-19 banner on niagaracounty.com. The state tracker will track all of those testing numbers for you. It will also show the breakdown for you where our county stands in relation to the rest of the state, which can be very helpful information to look at. There's still many testing sites that are operating in Niagara County, so if you are looking for a testing site and feel that you have a need to go get tested, we certainly encourage you to do so. You can go again to the top of niagaracounty.com and find a link that will take you to the test site locator on the state's webpage. All you need to do, it's very simple, you're just going to put in your address. It will show you all of the current testing sites that are located right in your area, so that you can find all of their contact information, anything you need to know before you go. You do have to pre-register for those testing sites, so make sure that you're calling them in advance to find out what the requirements are and what you need to do to get signed up. But again, we continue to encourage our residents to get tested. If you have any symptoms, of course, you absolutely need to go. If you're out and about working more now, on the front lines especially, or around more people, we encourage you to keep getting those tests done. That testing data is very important to us here in the county to know where we stand and to keep an eye on those numbers as we move forward with the reopening process. Now, Dan, of course, when we talk about testing, of course, many people think of the actual sample that's collected at the testing site as the test, but in reality, it's the reagent that's used that determines the outcome of that test and whether or not the person is positive for COVID-19. And as testing is picking up around the country, we're hearing more and more about shortages of reagents leading to delays in test results here locally as well. Can you tell us a little bit more about what's happening with testing right now and what we're seeing in those time frames?
Sure, absolutely. In the beginning of this crisis, the difficulty was in getting the sampling kits to actually take the sample in order for it to be tested. And now with us doing 40,000 plus tests, and a lot of tests being done throughout New York State and across the country, the ability to do all those tests, sheer volume of tests is making it more difficult. Getting the reagent, which is critical, is also key. So some places are waiting as long as 10 days to get the results, which is unacceptable because you're going to have people out in the community potentially exposing others because they haven't gotten the result of their test. So we tell people, if you've gotten the test, stay low, stay quarantined, stay at home until you know the result of your test. Even though we don't like waiting that long, it's something we need to deal with. In terms of Niagara County, we formed a partnership with Erie County Medical Center a long time ago, months ago, in order to be able to do the testing. And our weekly every Wednesday we have a drive-through sampling a process. They've been able to supply the test kits and the reagent to do the tests all along. We've having results as quickly as 1 to 2 days. So that's a great thing for us. We'll continue to have those partnerships. It's an example of having a partnership developed before you need it, so that when you have it, you're ready to roll. So we did that. Hopefully we'll be able to continue to do that. If people want to get tested, get sampled through our process, they can call our nursing division at 278-1900, and we'll schedule that for that test. So it's important that people schedule, but once again, multiple sites within Niagara County. Make sure that you contact the testing site before you go there. But so far, we've been able to keep up with the demand through our drive-through. But throughout the county, it's getting more difficult every day. I've talked with CEOs of local hospitals. They're not able to do all the testing they want to do because of the testing kits, but also, even more importantly, the reagent isn't available. So we continue to try and work with them and try to get the people who make decisions in New York State to get those supplies to us now.
That's right. Something we talk about on my control room group as well with the other Western New York region leaders. We're sensing, again, this potential for a second wave to come as we're seeing other states upticking again, wanting to be sure that we're doing testing because, again, testing is very, very important. It helps us to get a true sense, like I said, of what's going on in our community here locally, so we know what we need to head off and work on ahead of time and be prepared, like you said. So what we watch is the infection rate. Again, that's the percentage of the tests that are coming back positive from all of those that are being tested. What are you seeing in our daily infection rates and what's happening there recently?
Right now we're about 3.1, a number that's been going down every few days for the past probably month and a half. It's a very important number. 3.1 is less than half of the state averages, excluding New York City. So we also look at the daily infection rate, and our infection rate goes anywhere between 1 and 2%. And I think until we get a vaccination that can handle that, we're going to continue to hover around that number. But we keep an eye on that every single day. We look for trends. Trends is a big part of what I look at. My trends are showing me that the number is continuing to go down, and the daily rate is hovering right around 1, sometimes 2%, but usually around 1%. So we'll continue to look at that. The only way this is successful is because of the public doing the things we've asked them to do. Wearing masks, making sure you're 6 feet away, washing your hands, don't go places in large crowds. Those things are only to stop the rate from increasing, but also so we're prepared for when we get the second wave. We don't want to be behind the curve when that second wave comes, because then it'll be too late. So we look at those regularly, we make changes when we need to, but the public is really the reason why this number is as good as it is.
Absolutely, and not just our businesses that have already reopened and we want to keep open, but we're also now looking forward to the reopening of schools potentially in the fall. And that infection rate becomes very important because we know that a region has to be under 5% infection rate by August 1st to be considered for school openings in the fall. So we need to really keep an eye on this number. Very important. Again, this is why we continue to encourage testing among our residents so we know exactly where that infection rate is falling and why it's so important to have those tests and supplies for the tests available here in the area going forward. Now, Dan, of course, the other metric that we look at very closely and have all along is the hospitalization rates. Those are looking good as well. They've been consistent for several weeks now, correct?
Right, yeah, and hospitalizations is a very key metric that the state looks at in terms of whether we continue to be open, continue to be in school, continue all those things. And right now the hospitalization rate has been good. We expect it ticks up and down a little bit, but once again, we look at the trend. The trend is the key number. So if we see a trend that's staying the same or lowering, that's really a good thing. I think we saw that by having less infections in the nursing homes, so less people will be hospitalized because they were in nursing home and got COVID. So those things really happen. And the thing we want to remain vigilant about is making sure we keep an eye on the hospitalizations, keep that number low, keep our hospitals from being presented with a surge. The surge, as you see across the country, is the key problem they're having in a lot of these other states. The hospitals cannot handle what they need to handle. Thankfully, we haven't been in that situation, but that's only because the hospitals, people like yourself, the hospital leaders are making decisions that are in the best interest of the public, and we need to continue to do that.
Absolutely. And in fact, the governor told us today that hospitalizations statewide today are at 716, which is the lowest number since March 18th. And again, only one of those currently here in Niagara County hospitalized. So again, these numbers are good, but as Director Stapleton says, we cannot get complacent. We need to keep following the guidelines and the protocols that got us here to begin with so that we stay here and keep seeing these good numbers. Now, Dan, to that end, people are watching other states that reopened earlier than us starting to have very big upswings again. We've talked about this quite a bit in the last week or two. And we've been open for a little while now, and we haven't really seen that. Even after the 4th of July, I think, we expected with parties and people socializing that weekend that we might see some after effect or a rise in our numbers, but we're not really seeing that. So it doesn't seem to be the case here, correct?
Right. I mean, we look at a daily. I think that's where you get the daily rate that might change. It might be 0.5% one day, and then a few days later, maybe 1.5 to 2%. So we see a little fluctuations like that. But once again, the most important thing is to look at the trend. The trend is what informs me to give advice that people like yourself implement these policies. So I think it's really important to look at that, not to get too caught up in the day-to-day numbers, but to be concentrating on the trends. And the trends I get probably about a half dozen to a dozen graphs every single day, and maps that I look at every single day that shows me where our numbers are. And right now, I'm seeing a very favorable trend line that's going down. We hope that continues. But once again, as you mentioned, and everybody's mentioning, the vigilance in these things are the number one thing we need to do. So we need people to take that serious, like they have been.
Right, and I think, we did start to see a little bit of an uptick around July 9th or so. In fact, the Buffalo News ran an article about hospitalizations in Erie County. They had gone up 4 or 5 days after that. But the good news is we're seeing that already coming down again. So we never saw a quick or significant peak from that. Maybe a minor uptick for a few days as a result, but nothing drastic. So again, things are good. Our numbers are holding steady as we can expect them and hope for them to be. So we keep moving forward from here. Now, we see these flare-ups in other areas, and Governor Cuomo today was very direct in his briefing, if you watched this morning, and his discussions about what's happening in bars and restaurants with the new rules about serving food with alcohol, and really the effects of big parties happening, younger crowds, and multiple times asked us, don't be stupid. In his own words, he made this very clear that he's concerned about the trend of ignoring guidelines, especially in establishments where drinking is happening. You're seeing people who are congregating for many, many hours. The more they're drinking and the inhibitions start to go, the less they're caring about masks and keeping away from each other. And that's where the new rules came from as far as food being served with restaurants. The governor also spoke quite a bit about local government and local law enforcement needing to really watch these things and monitor them in establishments and making that a priority now. Are you seeing a lot of calls, Dan, in your office from bars and restaurants and businesses like that?
Yeah, we're getting quite a few calls. The travel guidelines that the governor instituted a couple weeks ago, we're getting dozens of calls a week on that. We continue to take those seriously. The good thing is that people are taking notice of their surroundings, and now it's unusual for people to see people without masks. So people notice that. And I hate this term, but it's the new normal in many ways, and that people seem out of place when they don't have their mask on when they're in a large crowded area. So that's a good thing. We work with Sheriff Phil Seddy, his staff, Jonathan Schultz, Director of Office of Emergency Management. We work with him on a daily basis. Those are two of our more key departments that we deal with on a daily basis. Just this weekend we were dealing with them on issues. So we need to make sure that we're following the same guidelines and make sure that we work together as a team, because that's really what the public expects from us, and they should expect that from us, that we're working together. We'll continue to do that. It's difficult because we don't want to close down businesses. That's the last thing we want to do, and that's not good for anybody. But if people are putting others at risk, we have to make decisions, be very decisive, very consistent, and make the decisions that we'd rather not, because it's for the betterment of the entire public, not just individual businesses.
Right, and I'll be very clear when I say there are many bars and restaurants, most that I have been in, that are really trying hard to follow these guidelines and trying to comply with the state guidelines. But it can be difficult when patrons come in and don't want to follow those guidelines while they're in the establishment. And again, I ask all of the residents to really remember that this is about your businesses and their financial well-being, and the fact that you want to go to those businesses. You want to be able to go to your favorite restaurant or bar and see your friends and enjoy that company. And we can only do that if those guidelines are followed. So do it for yourself, do it for your loved ones to keep everyone healthy, but please also follow those mask guidelines for your businesses. The governor made it very clear today that the businesses that are not following the guidelines and the rules are the ones that could potentially ruin it for the ones who are. And that's very discouraging for the businesses who have worked so hard and struggled for so long to put new protocols in place, to make sure that their employees are trained and educated, and to try and help their patrons be educated and follow those guidelines as well. So again, I ask all of you, please, when you're out and about in public at all times, have that mask, know the rules when you go into that business, and follow those rules for the benefit of not just yourself and the other patrons, but for that business as well. Dan, the other threat that the governor is seeing is what's happening around the rest of the country. Of course, we now know that 40 states and DC are seeing increases in their infection rate. And that's a real red flag. What can we do about that?
Well, I think it's a real concern that we people have. We're worried that even though somebody might be quarantined, the people who aren't following that rule, who just kind of come in for whatever reason, they're putting a lot of us at risk. I don't want us to have to go in the opposite direction. We are. Right now we're going in a great direction. The trends are all in our favor. We need to make sure that's under control before the next wave hits. That's the keys, being in control at that time. So we want to make sure that we control the spread. And because we're doing what we can to control the spread from travelers, we also need to make sure we control the spread within our own county borders, because there are people who are out there and not following the rules, not following the guidelines, not having their masks on. And it sounds like a broken record, but that's the simplest way to stop the spread and for us to open even further. I had a call with a state school superintendent today. I have a call with all the superintendents tomorrow. I have another scheduled call later on this week, because they want to open up. But if our numbers don't continue to be where they are, relatively good numbers, then that puts school openings at risk as well. So we want to make sure we do it smartly. But people, as long as they take it serious, we'll be on our way to opening schools, but it needs to be done with the entire community committed to making sure we stop the spread.
Thank you. And thank you again, Dan, of course, for your help, your team's help. We know that this has been many months now of working hard, late hours, weekends too.
You're on the calls with me. You know that.
Absolutely. It can be draining, but we have a fantastic team here in Niagara County. All of our residents need to know that. You have an amazing staff working hard for you to keep you healthy and safe and to keep those businesses open and running the way that we want and need them to. So we ask again for your support and your participation in the process to help us keep helping you to move things forward and not backwards. Now, a few other topics I would like to touch on for today. Our Social Services Commissioner, Megan Lutz, wants to remind everyone that last week the governor announced a new COVID-19 rent relief program. This is very important. We know that so many individuals have been off of work during this time, or maybe unfortunately have lost their job altogether. And rent is one, of course, very important, but sometimes very hard to meet that obligation. So please know, if you're having difficulty making your rent payments, you can visit hcr.ny.gov/RRP. Again, this is for the Rent Relief Program. You can find information in the application right on that webpage. Also, last month, our Niagara County Refuse Department launched a Household Hazardous Waste Voucher Program. This becomes very important. We know that many people were home and cleaning out while they had time off of work, and now you have all of these hazardous waste products in your home that need to be disposed of safely and need a place to take them. Of course, we often have drives throughout the county and the different municipalities, and we're just unable to do that at this time. So again, there are vouchers now available for you. You can go online to recycling at niagaracounty.com for more information. You can also find out about the program on our county Facebook page, where there are details and instructions for how to take part in that free program for county residents. Now again, as we've been reminding you all along, Niagara County does have a crisis hotline number that's 24/7 free and confidential help for anyone who might be struggling right now and needs some additional support. Please don't hesitate to reach out. We're all dealing with so much right now, so much uncertainty, so much stress and anxiety, things that are just difficult to deal with on your own. Please call 716-285-3515. Again, they are there and wanting to help you, so don't be afraid to reach out. If you joined us late today, you can catch us on demand on lctv.net under the On Demand page for the Niagara County Legislature. Watch this broadcast at your convenience. LCTV has been a wonderful partnership throughout this pandemic and helping us to get the information out to you, our residents, and sharing that with you. So thank you again to LCTV, and they will replay this broadcast during their schedule today as time allows. Thank you, of course, to all of the other broadcast companies who have decided to pick up our broadcasts and share them as well. We certainly appreciate that. Everyone, keep wearing your masks. Keep following those guidelines and keep Niagara County moving forward. We know that you're out and about to work now. More people are out at restaurants, shopping, doing those things that we miss so much. But please, most importantly, stay healthy, Niagara.
Jail's coming. Hello, everybody, and welcome once again to Focus on Niagara, a program of the Niagara County Department of Economic Development. Our program is designed to inform you of the latest economic development initiatives and programs of our department and those of our economic development partners. Our department reports to the Niagara County Legislature's Economic Development Committee, chaired by legislator Richard Andres, and has a professional staff that includes planning, environmental, and business development personnel providing services to all 20 municipalities in Niagara County. And on the program today, it's kind of funny because pre-COVID-19, you were there. Lynn Oswald, director of the Small Business Development Center at NCCC. Welcome back to the program.
Thank you. Thank you for having me. I'm a lot more tired now than I was then.
I could imagine. And you were one of the, this is one of our newest programs since the COVID-19 outbreak. And you were one of the last ones that we interviewed before we all went into New York pause. Well, so welcome back. I hope you're unpaused.
Thank you. Oh, we've never paused at the SBDC. We've been working very hard to try to get everyone through this and appreciate being here today, so thank you.
Well, talk to us first, before we get into some of the programs that we want to discuss, about how the pandemic has affected the way you and your staff at the Small Business Development Center are doing business.
Well, for simple things, we're all working from home right now. No, we're not meeting with anyone live in person, but we're doing a lot of Zoom calls and a lot of just great phone conversations. We've been able to keep our service up nonstop, and we're very proud that we didn't close for even a single day. And people really need us right now, and we really do our best to answer those emails quickly and get back to you, or even answer the phone live if we can, because people really do appreciate having someone to talk to right now.
Yeah, you know, I know that, and you've been a fantastic part of the Restart Niagara group, Lynn, and we appreciate your expertise and the expertise of your staff. We want to make sure always that, you know, we help businesses with the reopening guidelines and the reopening plans, and give them some good guidance, and you've been there to help them along the way.
Well, thank you. That's been a great group. The county, I don't know if the businesses in the county are aware of the teamwork that's been going on within the county, and then the newsletter that has gone out from the county that keeps people abreast of everything that's been going on and all the resources. So I'm very proud to be a part of Niagara County right now.
No, and we're glad you're a part of it.
Thank you.
In terms of we talk about all these guidelines. You know, I got to tell you, Lynn, we're still getting calls from businesses, and I'm sure you are too, looking for assistance, and that are even at this point unaware that they have to abide by certain safety protocols when they're developing the reopening plans. We're in phase 4 now.
Right.
You know, so I mean, everyone should have some semblance of a reopening plan posted at their site.
Right, and they are specific to your industry, so making sure you're using the correct one. And it's easy enough to do. New York has set up a very good website where you can put in your NAICS code that identifies your industry, get your plan. You can get the link to the affirmation form. That is a generic form, but the actual plan itself is designed for your industry, and it has things you must adhere to, and then it has things you really should be doing. So it has 2 lists. Yeah. And they're very comprehensive, and most of our businesses have had no trouble adhering to them, but it is, like you say, surprising that some people still don't seem to know that this is important, and if a local official were to walk in and ask you for yours, you better have it handy.
Right. And you know, and I wanted to take a little bit of time, not a lot, because I want to get to some of your programs, to talk about some of the procedures and what's out there that they could use to help them, you know, get these reopening plans up and their safety plan up and running, and also submitted to the state of New York. You have to do that. But what Lynn was just talking about is this. I don't know if you could see this. That this is what Lynn was talking about. Here on this side of the reopening guidelines, you've got what's mandated, and on the other side of the reopening guidelines, you have a list of best practices. You know, so I mean, this is exactly what you'll get on our website. And if you'll indulge me just a little bit, Lynn, you'll find on our website, www.niagaracountybusiness.com, and there you see it. Thank you, Rich. Up on the website, you'll see that little red button. That is a COVID-19 button, and you're looking right now at the business reopening guidelines. I want to remind everybody that as part of the phased plan to reopen New York, all businesses, not just some, all businesses are required to develop a plan prior to opening for how they will operate to ensure the health and safety of employees and customers. And on that website, you'll find information on the phased plan to reopen New York, as well as links to guidelines and protocols, like Lynn said, broken down by industry. It's important that you review, because these are industry by industry guidelines. The material that you'll find on the website, our website, can be used as a template and definitely will assist you in putting together your plan. And like Lynn said, it's important to check back often because things change. As time passes, things change. Now, the 4 phases are broken down, like Lynn said, by industry sector. On our website, you'll find links to all the guidelines detailing steps that must be taken to safely open your business. A business safety template is there that you could choose to use on your own. And there is a business affirmation form on there as well that New York State is requiring that you complete. And then there's a submit button at the end that you click submit. Then the state of New York now knows that you're open. And then you might get a call from time to time from someone to make sure that you're following your guidelines. When you do this, when you fill out your reopening plan and when you submit that affirmation to the state, make sure you print it before you hit submit. And also, you want to make sure that those guidelines are printed. You want to post them somewhere at your site so that not only your employees can see, but also patrons can see and give them a little bit of a sense
And
of.
that's a huge point.
Yeah.
Your employees have to be on board with this. And it's more than just an actual safety tool. It's actually a marketing tool as well. People want to do businesses where they feel safe. And if they have a choice between your business and another business and they feel safer at yours, they're going to come and see you.
Thank you. That's a very,
It
very
is
important
important.
point. It really, and most businesses that I'm sure call you and that have called us at our office, they want to do the right
They
thing.
do. They really do. I
Right?
have not had a single person say, how can I get around this? Every single person really wants to comply. But either they just have procrastinated or they were maybe following guidelines they got from a trade association. And while those are very good, you really do need the New York State official
Sure
ones.
you do. And again, remember, we just wanted to take a little bit of time on the show today to remind you that you need to do that. You need to put your reopening plan together. You can use all that information on our website as a template. You got to fill out the business affirmation form and